I'm going to be doing is conducting a thorough assessment of both your eyes and your ears. Do you have any questions?
You can call me Nikki.
Thank you very much. Okay? What I'm going to do, when I first entered the room, the first thing I noticed was that my patient's gait was proper and smooth. I noticed that her hygiene seemed to be appropriate. There was no foul odors. Her skin is intact and clear. Excuse me. Her posture is erect and comfortable. Let's see, anything else? Her age, she seems to be her appropriate age of 19. Her dress is both appropriate for the age and the weather. And that's about it. Okay? The first thing I'm going to do, Nicole, is I'm going to start with the eye exam. Okay? So what I'd like to do is I'm going to do the Snellen assessment as well as the Rosenberg. Now both of these would have been conducted outside, seeing as I don't have 20 feet in here to do the Snell chart, but what I would do is have the patient stand 20 feet away from the Snell chart and read off the lines to the point where she can't read anymore, and hopefully it'll be 20/20, which I did before, and as long as she has her glasses on, she has 20/20 vision. Okay? Moving on. What I'm going to do now, Nikki, is I'm going to assess your eyes. If you could please remove your glasses and lift them up. Okay? I'm going to look at her eyebrows and her eyelashes, and I see that they are both present and equally distributed. I'm going to look excuse me, I'm sorry, at her eyelids and as well as her eye bottom, and I see that there is no sclera located above or below the iris, which is normal. Now I'm going to move on to the oculomotor parts, and I see that her sclera is white and clear, which is normal. Her iris is fully colored in green. Her pupils are 2 millimeters, which is normal. That's about it. Oh, and her cornea is clear and transparent and smooth, which is also normal. Okay, moving on. I'm going to also inspect your bulbar conjunctiva and make sure that it is clear, moist, and smooth. Okay, now what I'm going to do is I'm going to palpate, but I'm going to put gloves on just because I'm going next to a mucous membrane. Is that okay? Okay. The first thing that I'm going to palpate is her lacrimal glands, located next to the nose. I'm going to make sure that they're not red or tender. Does this hurt at all? Okay, and there is no discharge. Likewise, I'm going to inspect the conjunctiva. I'm going to pull the lower lids down and see that they're both pink and warm and moist. Okay, now I'm going to remove my gloves and place them in the trash. Okay. Now what I'm going to do is inspect the 6 cardinal fields of gaze. Nikki, what I'm going to do is I'm going to make a star with this pen light. If you could please follow it. Very good. She followed it well. All oculomotor reflexes are intact. Now what I'm going to do is the cardinal light reflex. What I'm going to do is shine it on the bridge of her nose and make sure that the light reflects on both cornea at the same start, representing parallel alignment. Nikki, if you could just look straight ahead. Okay, parallel alignment is good. Now what I'm going to do is the cover and uncover test. So Nikki, what I'm going to have you do is if you could please hold this paper up against your right eye, and then again on your left eye. And what I'm looking for is any abnormal movements of the eye, which there was none, which is normal. And now what I'm going to do is assess the pupils for dilation. But first I need to turn the lights off. So. Okay, Nikki, if you could just look straight ahead. Okay, and her pupils did constrict with the light, and they did dilate when the light was removed, which is normal. Okay, now while the lights are off, I'm also going to test, excuse me, for the red reflux using my ophthalmoscope. Okay, Nikki, again, if you could look straight ahead. Okay, and the red reflex is present, which is normal. I also noticed that her pupils are equal, round, they reacted to the light, and they are accommodating. Okay, now, Nikki, what I'm going to do is move on to the ear exam, okay? But I'm going to turn the light on first. I'm sorry. Okay, the first thing I'm going to do is test for auditory acuity. So what I'm going to do is I'm going to whisper a word behind my hand. If you could please repeat that word back to me. Okay? Cat. Dog. Boy. Okay. She was able to repeat all 3 words back to me correctly. Next, what I'm going to do is the Ryan and Weber test using my tuning fork. Starting with the Weber. Nikki, can you hear this in both ears? No. Okay, if she can hear this in both ears, that means there is no lateralization present, which is normal. Next, I'm going to do the Ryan test and place it on the mastoid process. Nikki, can you hear this? Can you let me know when it fades out? It stopped. And can you still hear it? Okay, and then again. And then again on this here. Can you let me know when this fades out? Okay. And can you still hear it? No. Okay, Nikki was able to continue hearing longer through the airway passages than she could through the bone, which is normal. Now what I'm going to do is inspect the external ear. And I noticed that they are both the same size, that the color is consistent with the rest of the face, that they are lined up with the corner of the eyes, that there is no lesions, lumps or nodules, and there is no excessive discharge. Excuse me. Okay, now what I'm going to do is inspect the internal auditory canal using my otoscope. Okay, I'm going to place a clean cover on it. Turn it on. Okay. And now I'm going to pull the ear up, back, and away, and look inside. Now I'm looking at the external auditory canal, and I'm seeing that it is pink, smooth. There are no lesions or excessive discharge. There's a small amount of sebum, which is normal. Okay, now I'm going to look at the tympanic membrane, and I see that it is a pearly shade of gray. It is concave. It is intact, smooth, and free of lesions. Okay, and I'm going to perform this again on her other ear. Pulling it up, back, and away. I'm going to look at the external auditory canal and see that it is pink, smooth, free of lesions or bumps. There is no excessive discharge. There is a small amount of sebum. And again, the tympanic membrane is a pearly shade of gray. It is intact and smooth. Okay, and all bony prominences are present. Turning my scope off. Okay. Light reflection in the ears. On the right ear, the light reflection was located at 5 o'clock, and in the left ear, it was located at 7 o'clock. This concludes my demonstration. Thank you, Nikki, and have a nice day. Okay, now this is the part where you can say anything that we missed. Okay.
Do you want to rewind it? Or?
No, I don't think so. Okay, so what I would have done in the beginning is I've already taken her vitals and her history, as well as a comprehensive history assessment, as well as her height and weight. I forgot to say that, but I know that I did it. To palpate her ears. So Nikki, if you don't mind, I'm going to just palpate your ears. Does this hurt at all? Or is it tender? There is no pain or tenderness, which is a normal finding. This concludes my presentation. Thank you, Nikki, very much, and it was nice meeting you.
Alright guys, so that was me quite a few years ago now, in the same position as you. So if I can do it, you can do it. Okay?